Hello everybody, my name is Yinka Kuya and I am the Head of Pharmacy Primary Care Transformation for the Medicine Optimization team for Fimini ICB. And I'm joined here today with colleagues. Ross, would you like to introduce yourself, Ross?
Hi, hello, my name is Ross Burton. I'm one of the Senior Medicines Optimization Lead Pharmacists here from the ICB.
Thank you, Ross. And Caroline.
Hi, my name's Caroline Pote and I'm one of the from the ICB support pharmacists.
Thank you. So today what we're hoping to do is do a bit of a run through of how to use the local services button within the Optum system, or EMIS as it was called, to refer patients into the Pharmacy First service. Now, just because of patient confidentiality information, we couldn't really take you from the very beginning, but just to let you know, you can access the local services button by doing one or two things. So if you can see the cursor moving at the top there, that's the summary page. So you can access through the summary page, or you could access through the consultation page as well. And hopefully you can see the cursor moving at the very top of the screen there. And then you will see the local services button at the far right hand side there, and you click into that, and this is the first screen that pops up. In fact, that's not the first screen, Ross, is it? I think there's another screen. Yes, this is what pops up when you click into your local services button. And then this is for Pharmacy First formal referrals, or what we like to say digital referrals, and this is what we use to assess for referral. And it's really important that we click assess to refer. Do not use the create referral, and we'll talk about that one in the next video, but for now it's assess to refer. Thank you, Ross. And then you've got a bit of a disclaimer here that you should read, and obviously tick the box to say that you have read and understood the disclaimer. And there's some more information about the functionality of the triage screen. And then if you scroll to the bottom, again, you click to say that you've viewed the information if you want to, which is the highlighted link there. And when you're happy, you can continue. Now, I think it's important to recognize that when a patient does contact the practice for an appointment, just going straight into your local services button is really probably very straightforward, and will give you the opportunity to use the tool to ask the questions that you need to ask to know how to triage the patient appropriately. So this is obviously Pharmacy First, and there's a little bit of blurb here around what pharmacists can do in terms of treating minor illnesses, being highly trained healthcare professionals. So you then go on to answering the question, which is highlighted in bold. Does your query relate to a child under 1 year of age? If we click yes, Ross, if you don't mind clicking yes, what you will see here, it will tell you Pharmacy First is not suitable for children under 1 year of age, and therefore need to make an appointment with the GP. So for this video, obviously we will say no, the child is older than 1 year old. So we click no, and then start assessments. Then there's some red flags here, because obviously, as you can see, signs of heart attack and what have you would require immediate referral to the GP and or 999, depending on what happens here. But obviously this would not be a Pharmacy First referral. So does the patient have any of the symptoms above? Then we would say no, otherwise we do not continue with this assessment. Continue. Now, for the purposes of this, I think we could use UTI. It's one of the most common conditions that is referred into Pharmacy First. So let's use UTI. So this is uncomplicated UTI. Click continue. Thank you, Ross. So now you're in, actually, Ross, can we go back? Because what I would like to show you is if you click on that drop down, there's a whole list of all minor illnesses. So I think it's really important to highlight that there's a whole array of conditions you can refer a patient to Pharmacy First. It's not just the 7 conditions. It's all of these and more minor illnesses. But for argument's sake, today we look at UTI. Let's continue. Thank you. So now it's telling you you're in this assessment for a cystitis referral or UTI, but highlighted it does say women aged 16 to 64 years of age. If that's not the case, this cannot continue as a pharmacy first referral and then his GP appointment. So as you can see here, there's a couple of symptoms that you would be talking to the patient to understand whether or not they're experiencing the symptoms like burning or stinging, cloudy urine, needing to get up in the middle of the night, and other symptoms of UTI you can see are also there as well. But then you scroll down and then you would ask the patient whether or not they have any of the following conditions. If they do, it could be that that would not then be a referral into pharmacy first and it would be a referral to the GP. But again, you know, this is usually uncomplicated UTIs that you will be dealing with. So we would say none of the above and continue. Again, this is about making sure that we get the right patients to community pharmacies. So we would ask the patient, do they have the above symptoms? If they have none or one, then it might not be cystitis or UTI, it might be something else and they need to see their GP. But if we say they've got 2 or 3 of the above, continue, then it will allow you to carry on with the assessment. And then again, I think this is back to red flags, if I remember correctly. Am I right here, Caroline? What is this page here?
Yeah, that's right. So the community pharmacy is following a service specification, and they will only be able to provide antibiotics if it's suitable for the patient under certain conditions. So, for example, one of the things on this list 4 down says, are you allergic to nitrofurantoin? So if they have an allergy to the antibiotic that is what could be provided by the community pharmacy, and you click this, then it won't allow you to continue to refer the patient into the pharmacy and you'd have to refer them elsewhere. So that's like an example.
Thank you. So therefore we say none of the above, because hopefully this is an uncomplicated patient. And then it's saying, so your answers, so going through that assessment, it's saying your answer now suggests that you may need antibiotics. Thank you, Ross, highlighting it there. And please note that this will depend on your assessment by a healthcare professional. So a really important note to share with the patient that although, you know, going through this sort of basic assessment is indicating it could be UTI and they could need antibiotics, the pharmacist, when they speak to the patient, will still do another assessment, and it might be that the patient won't get antibiotics. So it's important that they say that you do let them know that they will still need an assessment by the pharmacist. And if they're happy to be referred into the pharmacy, then you would continue. However, if they sort of said, you know what, I really don't want to go to the pharmacy because I've had cystitis multiple times before, I forgot to tell you this, then you would decline the referral and then you would then make an appointment for the patient. Caroline, do you want to come in and say the bit that you were saying about, you know, the speed of pharmacy first versus appointments?
Yeah, so sometimes surgeries release their appointments in the morning, and once they've allocated those to patients, there might be no appointments left to see this particular patient on that day. So they might be able to book the patient in to see a doctor within the next couple of days, or ask them to ring back the next morning for an on-the-day appointment. And there's a bit of a delay. But with Pharmacy First, you can the patient can walk in or contact the pharmacy on the same day. So they should be able to get like that on the day appointment that they were probably hoping for at the GP practice if there's none left available. So
thank you, Caroline. And I think it's an important point to raise, especially if there's a little bit of hesitancy or resistance, just to highlight that, you know, we are referring through this great service that we have available where you can actually get an appointment you know, on the day with a pharmacist and get the medication that you need on the day with a pharmacist, especially if there's any hesitancy. So please do let them know about the advantages there. So our patient will, of course, be more than happy to be referred to their community pharmacy. So we will click continue. And then this is where you will sort of share the information with the pharmacy in terms of the patient's symptoms, which is the first box, details of any kind of self-care, because it's really important that if they've tried certain things already, that the pharmacist knows about it. It just helps to have a more robust conversation when the pharmacist sees the patient. And then if there's any patient concerns, so we're talking about, you know, person-centered care, understanding the patient's concerns is really important. So once we've filled that bit in. It doesn't need to be an essay, just a couple of lines, a couple of bits of information. Then you please tick the box to confirm that the patient understands the statement. And the statement is that this service is intended for electronic communication between you and your healthcare provider. The information may be read by your pharmacist or a designated member of the pharmacy team, and the pharmacy will not be able to respond to urgent requests through this service. So it's a disclaimer again, tick that they're happy, and then you can create the referral to the pharmacy. And this is where the patient has a choice as to which pharmacy they want to go to. What you'll find is the local pharmacies to your practice will be the ones that come up first, but of course the patient can choose any pharmacy they want. And as you can see, there's a little box there to put the postcode of the pharmacy that they want to go to, or if it is Superdrug, for example, in the high street, you can just click Superdrug. Let's click Superdrug for argument's sake. And then you've got the patient details come up automatically. And then if you go to the bottom, Caroline, you said something really useful, I think, which you want to share about the phone number.
Yeah, that's right. So if you just stop there a sec, Ross, before you scroll any further, but there's a couple of things that you can add onto this form just so that the pharmacy can see what the patient's coming in for. So just off the top of my screen, if you could just scroll a bit further up, Ross, it asks what condition so it says please enter underneath date of birth, it says please enter the condition this referral relates to. So if you can just provide a little bit of information there, it can just help the pharmacy know why the patient's coming in. And then if you can just confirm the patient telephone number is the telephone number that the pharmacy would be able to contact the patient on, if that's correct, or even if they're with a friend or something and they've got a different telephone number for that day, whatever it is, the pharmacy needs to be able to contact the patient to be able to or either arrange for a call or follow up. It is the patient's responsibility, though, to make contact with the pharmacy. So this is a backup.
That's really helpful. Thank you, Caroline. And then you can put the email address. Is that the patient's email address, I think, isn't it? If you wanted to there as well. And then would the patient like to receive a summary of the assessment details by email? That's where the email details come in. It's either yes or no. And then we won't obviously click the button because we don't want to send a referral to Superdrug with Minnie Mouse as the title, but that is exactly what you would do. You would create the referral. And as you can see, this whole conversation is been 6 minutes, and that's with us, going back and forth, talking you through what to click and how to do it. So hopefully that's really helpful to sort of demonstrate how you create a digital referral. This is to minimize signposting patients, so saying, oh, just pop over to your pharmacy. Every referral should be created digitally. That way you have a complete audit trail of patients that contact the pharmacy and then contact the surgery, and actually then what happens with that patient in terms of outcomes. Hopefully that was useful. Thank you very much.